We're back with another episode of Everything Melanin. Today we're going to speak about how to take better care of our melanin-rich skin. Doctor, I wanted to start with the first step, moisturizing. What advice do you have for melanin-rich skin on moisturizing?
So like I said in an earlier episode, our skin has a higher need for moisturizers. But what I commonly notice is that a lot of patients skip this important step in their skincare routine. Mainly because of few common reasons I would like to say right now. One, it would be that they are scared that moisturizers make the skin look duller and darker. They're also worried that moisturizers tend to increase their acne. Okay, so solution to this would be to use a moisturizer that's right for your skin type. Say for example, you have oily acne-prone skin. Choose a moisturizer that's more lighter, that's water-based, and is non-comedogenic. If you have skin which is on the drier side, choose a creamy, more hydrating moisturizer for your skin.
And the next big thing, sun protection. What advice do you have again on sun protection that melanin-rich skin must take care?
What I notice is that many of my patients are not using the right amount of sunscreen. This could be because they are not aware how much of sunscreen to use on a regular basis. Also because they are scared of the white cast that happens commonly with many sunscreens. I also notice that a lot of them skip sunscreen altogether. It could be because they think that they don't get sun exposure while they are indoors or driving in their car, or they think that it's only a 30-minute drive to their office, so they can skip sunscreen altogether. Or sometimes they are just scared that sunscreen gives them acne. I would say that using the right kind of sunscreen for your skin type and the right SPF for the activity is very important in your skincare.
So you said the right kind of sunscreen. So what factors should one keep in mind when choosing one?
The right kind of sunscreen is one which doesn't give you a white cast, which you like using consistently, and which doesn't trigger more acne in your acne-prone skin. It should also have the adequate SPF. For indoors, I think your sunscreen should have a minimum SPF of 30. For outdoors, your sunscreen should have a minimum SPF of 40. Also, you should choose a sunscreen which is broad spectrum because it gives you a more complete protection. And you should also use the right amount of sunscreen. For example, using the 3-finger rule when you are applying sunscreen to your face and neck would be useful.
So often what I've seen is that while many people are diligent about applying sunscreen on their faces, they often tend to ignore the bodies. Do you note that when speaking to your patients or in your practice?
Very commonly. So while I notice that people are very diligent in sunscreen application on the face and neck, they often ignore their bodies. You see, you are getting the same amount of sun exposure on your hands and feet as well. So I would say don't skip your body sunscreen, and maybe using a lotion-based or a spray format of sunscreen would be easier for you to apply and reapply sunscreen on the body.
Yes, those formats can be very useful for the body. The other issue that I see is, you remember we had spoken about our increased chances or our increased propensity to hyperpigment. So what advice do you have for people about sunscreen, those who are already struggling with pigmentation issues?
So I always prefer to prescribe a tinted sunscreen for those with hyperpigmentation issues, especially melasma. Because you see, those with hyperpigmentation or melasma specifically need to protect their skin both against outdoor exposure and also indoor exposure, for example, artificial light exposure. Tinted sunscreens offer you a more broader coverage, thus making it the ideal sunscreen for those with hyperpigmentation.
Great. Those are really very useful tips on how to take care of our melanin-rich skin. Thank you for your insights.